Guten Tag.
Dear ladies and gentlemen, here on site and also remotely, my name is Moritz Koch. I work for the Handelsblatt here in Brussels, and I'm very glad to be able to host today's event on a very important topic, the challenge of our health system with regards to antibiotic-resistant germs. Unfortunately, Minister Puttrich is not available here today. Apologies, the interpreters are no longer able to hear the presenter.
Von Frau Professor
Professor Deitelhoff. And we also have a short keynote presentation from Professor Schaible. And afterwards, we are going to have a panel discussion. You are also welcome to ask questions and through this telephone number. And I am looking forward to any questions raised at the end of the discussion. Thank you, dear Moritz Koch, for the welcome. Dear Dr. Liese, dear Professor Deitelhoff, dear Dr. Schaible, dear Dr. Philipp, ladies and gentlemen, I would like to warmly welcome you in the name of the Minister for Federal and European Affairs of the state of Hesse to our crisis talk today from the state representation of Hesse in Brussels. I also thank our partners from the Leibniz-Research Alliance and the Goethe University Frankfurt who are hosting this event series together with us. I'm very pleased to be able to have composed such a high caliber panel with regards to this topic. And this is a very current topic. The Swedish EU presidency would like to focus on antibiotic resistances since they consider it to be one of the greatest health threats our times. In the framework of the EU presidency, they would like to focus on the fact that human beings and animals should continue to be treated for bacterial infections. The access to antimicrobial means should be managed in a more sustainable manner in order to reduce resistances. Already in the 1940s, antibiotic resistances have been spreading, and medical research and politics have been taken up this topic. Antimicrobial resistances have been identified as one of three biggest health threats that require coordination measures at EU level. According to current figures of the European Centre for Disease and Prevention and Control, 35,000 Europeans die every year from antibiotic-resistant infections. In addition, antibiotic resistances in the EU generate increased health costs of 1.5 billion euros. The EU already in 2017 has called into life the action plan One Health that includes over 70 measures in 9 political areas and health of human beings and animals, agriculture, environment and research. It clearly expresses that human and animal health are connected to one another and that due to that both have to be tackled. According to a Eurobarometer survey of 17th of November 2022, every second EU citizen thinks that antibiotics are effective against viruses. 88% of antibiotics are being taken without a relevant prescription. The survey has also shown that the use of antibiotics has achieved a low level. Only 23% of people in Europe have taken oral antibiotics in 2021, the lowest figure since 2009. This is a very pleasant, positive development, but at the same time, we need initiatives and measures for tackling the spread of antibiotic-resistant pathogens. Before handing over to Professor Deitelhoff, I would like to thank our team for preparing this event, Dr. Pahisi, Mr. Golashinsky, Mr. Radu, Mr. Fernane, as well as the interns of the state representation. Thank you. Good afternoon. I'm very pleased to be able to welcome you to one of 4 crisis talks and the 18th crisis talk overall. They have become established as a format where issues of high importance for the European Union in an exchange between scientific findings and political practice are being discussed. For this first talk, we have invited colleagues from the Leibniz-Research Alliance Infections who are working on developing improved management of the threat of antimicrobial resistance, or AMR. The World Health Organization has described the threat of AMR as a silent pandemic, largely unnoticed by public attention. AMR claims millions of lives every year. In the European Union alone, they are estimated at over 30,000, and in other parts of this world, the number is many times higher. Already in 2017, the European Commission adopted an action plan, and also in the important international forums of the United Nations, the G20, the G7, or the OECD, the topic of the silent pandemic has been put on the agenda. Nevertheless, the acute crisis of the last few years, the corona pandemic, the Russia-Ukraine war, the social polarization we observe in many societies have caused for this pandemic to be set into the background. But that is precisely the great challenge. We live in a time of multiple crises. There we must succeed in not managing one crisis at the expense of paying attention to other crises, and also keep in mind that crises can be mutually reinforcing. So these are the not exactly small topics that Crisis Talk has set itself today. And I would like to conclude by once again thanking all the partners who made this Crisis Talk possible. Of course, the state representation of Hesse in Brussels, the European Office of the Leibniz Association, the Research Center for Normative Order at the Goethe University in Frankfurt, and today, of course, especially the colleagues of the Leibniz Research Network Infection. And now I wish you a stimulating discussion and many insights into this very important topic. Thank you very much.
Ja, meine Damen und Herren.
Yes, ladies and gentlemen, we're going to continue after this first introduction with a part that is going to go into this aspect further by Dr. Schaible. He works at the Institute in Leibniz, and he is in the scientist team for infections. He can tell us from first hand how big this challenge is going to be for our health system. Thank you. Yes. Thank you for having me today, and thank you for giving us the chance to present our team, our subject, and to talk about how important this really is. This is a global crisis. As Ms. Deitelhoff has said already, it's a silent pandemic. It's a silent pandemic, indeed it is. But of course, we have already seen with the G20 in Hamburg, for example, that it was stated very clearly that the AMR is a challenge to global health. And they also explicitly mention germs that we can see at the bottom of this slide. It is very important to understand that worldwide we have about 5 million people dying of AMR-related diseases every year. And this is only for the germs listed. We're in a process of evolution. The active ingredients that can be used against certain diseases leads to germs that are more resistant to said active ingredients. This is something that can happen at high doses or low doses, can happen in nature. This can happen in any matter of situations. It's also very important that we're just not just talking about bacteria, we're also talking about parasite, about fungi, and also about viruses. In light of this, the list of the World Health Organization has a crisis priority, high priority, and medium priority list. That based on the resistances that these germs have built up. When the first antibiotics have entered pharmacies and hospitals, this was a big solution. We did have a golden age between, say, 1940 and 1970, if you will. During this time, lots of new types of antibiotics were found also to combat parasites and such, but we are past this golden age. We are really past our prime when it comes to finding new active ingredients, and it has been 30 years since there has been a registration of any new antibiotic. On the right-hand side, you can also see the blue list. This is when hospitals started using antibiotics. And on the right-hand side, you see the first resistances of resistance against this antibiotic. An illness that is very important to me and I want to talk about more is an illness that has a great problem with this resistance against antibiotics, namely tuberculosis. Multi-resistant tuberculosis are increasing rapidly, particularly in Central Asia and Eastern Europe. I'm just going to say Ukraine. This is one of the countries where you have many cases of MDR. And these bacteria cannot be attacked or treated properly. We already have 1.5 million people per year dying because of this disease, and this will increase. On the left-hand side, you see an overview of the increase in resistance versus HIV medication. This medication right now allows for people infected by HIV to live a pretty much normal life. We also see that with influenza, we have an increased amount of resistances as well. And malaria, which is very active in Southeast Asia, also becomes more and more resistant. Then fungi. When you talk about pathogens, you don't really think about fungi first, but we have 1.5 million people per year dying because of this, especially in particular areas. We have 3 active ingredients to fight against this, which is fluconazole and 2 others. We have one candidate that is also expanding rapidly and that is resistant against these active ingredients. We are also using these active ingredients for tulips in Japan, for example, before they're being sent to Europe. We have more and more germs that are becoming resistant to these antibiotics. And this is where the One Health subject is coming our way. It's extremely relevant. The wave is coming our way already, and we can't just stand by and watch. It's very important that we take worldwide action on antibiotics, that we only use antibiotics when they are really useful for the therapy. We need to have a good stewardship. This needs to be intensified more. We need better surveillance of resistances and early warning systems. We need to have monitoring of active ingredients. We need to prevent emissions into nature. We need to have inactivation measures, for example, in fertilizer. We have to reduce the use of antibiotics in animal husbandry. We need to have better management. We need to find different ways to make sure the animals stay healthy. To my knowledge, cholesterol, for example, can no longer be used in animal husbandry. We need a quality control of active ingredients on national markets because we have many falsifications or reduced amounts of active ingredient in the medication. We need to identify and develop different antibiotics, and we need to work with different and alternative therapies. We also need to work on preventative measures. This means that we have to do more research and development. And this in a field where we don't really see a lot of research and development anymore. In the USA, we have $1.8 billion that is antimicrobial venture capital investment. In total, however, we have 38 billion euros being invested elsewhere. The funding of the National Institute of Health for antimicrobial resistance was 1.2% and 18.6% against cancer. I really think something needs to be done here. Think of the SARS-CoV-2 epidemic. This has shown that we have different ways of reacting quickly. Very important, we've talked about this also, 1/3 of all prescriptions of antibiotics in the USA and UK are unnecessary. In Malawi, they say that all patients who have a fever should get antibiotics. And in many countries with a lower or middle income, antibiotics can be bought without any prescription. And when people feel sick or have a cold, this is what they buy. This is something that needs to be regulated differently. Many antibiotics and antimicrobial active ingredients are falsified or have their amount of active ingredient reduced. That, however, is not a good thing because we need to make sure that when we use it very actively. We don't want the pathogens to fight through it. We have talked about animal husbandry and agriculture and how antibiotics are being used there. Right now, the limits of antibiotics in Europe are limited. However, there are situations where the amount of antibiotics used can be reduced. Look at the Scandinavian countries who have since 2018 strongly limited the use of antibiotics in animal husbandry. This is not the case in other countries where the usage just stayed the same. It's very interesting to see what happens when we have pathogens that can also infect humans. When it changes and adapts to a new host, it can also lose the resistance. We have particular germs that are resistant to some antibiotics, and when they jump to humans, they can hold on to this resistance for a very long time. We have many large amounts of antibiotics that end up in nature. We've talked about animal husbandry, also in cultivation of plants, but also in production. We have big production companies in China, for example, who produce lots of antibiotics, who just dump partially antibiotics also in wastewater. And if this ends up in nature, we're going to end up with germs that are resistant to these antibiotics also. This shows where the resistance against cholesterol can be shown. That is a spare antibiotic that actually shouldn't be used, but sadly still is being used in animal husbandry. As I said, this is a spare antibiotic. Right now in China, it's not just in people, it's not just in animals, it's also in nature, in the environment. And it's something that is very hard to combat once we've hit this stadium. So how do we organize the community? How do we organize politicians and scientists to rally behind this? We need interdisciplinary cooperation. We need to talk with agrarians. We need to talk with the industry. And we need to incentivize all partners to cooperate with us. We need pharmacists to work on antimicrobial active ingredients more. We have good examples from parts of the industry. We have GSK, for example, a non-profit laboratory that is working on active ingredients against TBC and malaria. They're active in Spain. This is just one of the examples. We need to work together across disciplines in order to tackle this problem. This is why we have the Leibniz-Forschungsverbund, the Organization for Cooperation. We have many organizations that we give room for cooperation through our cooperation. We try to bring people together the best we can to optimize their cooperation. I'd like to thank you very much for your attention and look forward to discussion.
Thank you, Dr. Schaible, and I would like to welcome you on our panel discussion now, and I would also like to throw in a few more ideas. I would also like to welcome Dr. Philipp, the deputy head of HERA, the organization, the Health Emergency Preparedness and Response Authority. In the further course of the discussion, we will also be joined by Dr. Peter Liese here on stage. Dr. Liese, I think, is well known to everybody here in Brussels. He's one of the leading voices in health politics in the European Parliament, and he's going to join us later as soon as he is available. Unfortunately, he has not been able to join us earlier. Dr. Philipp, perhaps I'll start with you. You just had to tackle the corona pandemic, and now we have come to a stage where we no longer have to be in a state of warning, but perhaps that is too early. Do you fear that with that discussion that we're holding today, we can already see what is ahead of you at HERA? The fight against resistant pathogens, is that the next big health crisis? First of all, I can just add to what Dr. Schaible has said. I think we are already in the midst of this crisis, a proper health crisis that continues to evolve, but perhaps it hasn't very much been on our radar, at least for those organizations that tackle crises. But we have seen the figures. These figures are frightening. But at the end of the day, it is a question of how can we counteract? I think there are still measures in certain areas how we can counteract, and this is what we try at HERA. With the possibilities that we have, HERA has been existing for a little over a year, and one of the first tasks was to actually determine health threats so that we can actually have a focus of our work. And one of the biggest health risks that we identified is not a surprise. One of them is antimicrobial resistances. Also with regards to viral pathogens, and also radionuclear threats. These are the three areas that we determined as the biggest health risks. But to come back to our topic, we have been doing a lot. We have been commissioning studies in order to find out whether stockpiling is sensible with regards to certain antibiotics. We have had a lot of press information with regards to this over the last few weeks, certain antibiotics that weren't available, and we also commissioned another study in order to find out what would be sensible incentives in order to invest into research with regards to antibiotic-resistant pathogens. I think it is generally well known that antibiotic development is rather costly, but there is not a proper market since these products are not that expensive. Therefore, there is a problem with regards to the business model, and at HERA, in cooperation with other commission services and national partners, we are very much interested in finding solutions for models, incentives that can be implemented in the EU and that can be implemented by the member states. Let's come back to those incentives. And perhaps, first of all, the question to Dr. Schaible. Your keynote presentation was only interesting since you described the problem, but you also presented solutions, possible solutions or mitigation measures. Do you think that with regards to or due to the increase in population and increasing animal breeding, do you think it is realistic that the world is going to manage to find a global agreement with regards to that in order to tackle this problem? Since if there are certain regions in the world that are not going to contribute, we are probably not going to manage to tackle this problem. Well, I think the main problem is that we have to work together. We have to cooperate. We know that many of these multi-resistant pathogens not necessarily develop in Europe, but also in other areas of the world, and that are being spread globally due to the global transportation system. And due to that, it is about finding regulatory measures for the use of antibiotics, where a major number of countries will cooperate. And over the last decades, this is something that has gone lost, since everybody seems to believe that you can use antibiotics against anything. They are very valuable medication, for example, in intensive care. We wouldn't be able to carry out organ transplants without the use of antibiotics if we weren't able to use them. These are all things that are perhaps no longer possible the more multi-resistant pathogens we have. Also, here in the audience, we might have certain members of the public who carry multi-resistant pathogens. And usually this is not an issue, but if medical treatment needs to be carried out, this can pose a risk. Yes, we deal with a problem that can be compared to climate change and fossil fuels that we also use without further thinking, or we have been using them without further thinking about the long-term damage that they are going to lead in our system. And that is the same case with regard to antibiotics. According to your opinion, do you think it would be sensible to think about a resistance control and to discuss in the same sense that we discuss CO2 prices. Would that help in order to reduce the use of antibiotics in order to ensure that they are only being prescribed when they are needed? I think what is even more important is that we educate people, that we also educate doctors about those risks, and that we introduce regulatory measures. I think it is still a large problem in many countries in the global south where antibiotics are still being sold without prescriptions. And I think these should be medication that can only be obtained with a prescription. And also health ministries and other relevant stakeholders have to get involved in order so that these antibiotic medication cannot just be sold over the counter without prescription. I have lived in the US for some time, and our children were born in this country. And every time the children were coughing, usually antibiotics were being prescribed. This is something that doesn't only occur in the global south, but also in other countries, more developed countries. It is often also the parents that usually like to have a prescription for their children, even if perhaps it is a viral infection, but it gives them the feeling to be able to help their children, to at least give something. Dr. Philipp, perhaps you can also further describe the projects that you have been working on, also with regards to incentive control. We just talked about the fact, and Dr. Schaible also mentioned that in his keynote presentation, that there are very few new medication that is being brought onto the market. It is not worth investing since the profits are too low. How could national governments or how could the EU get involved in order to solve that? There are a lot of theories with regards to that and a number of reports. We always think that this is something, it is actually something rather expensive. You also have to break it down with regards to the population that is being focused on. For that, certain antibiotics are being developed, and also the time period in order to have certain return on investment. There are a number of reports. It is between 500 million and 3 billion. With regards to the population, what an incentive could cost. And what we could do is that certain models could be tried and tested. We are trying to create that together with member states. And this is about certain models that have been analyzed. Annual revenue guarantee, for example, where over a period of 10 years, a certain amount is being paid out. It is also about a combination of this model and upfront payment, so that this is being paid once the medication is being launched onto the market. And then we also have the possibility of, and perhaps that would be the preferred one, is that you just put a certain amount of money on the table and then you have a certain demand with regards to that. What is very difficult is which of these possibilities do you choose? And we are trying to set up a network of member states who can introduce these incentive systems together. It could be a common procurement that is being agreed upon in advance. together with companies who have developed certain products, so that once the product is on the market, there will be a certain guarantee of number of countries who are going to accept this product. And for example, that could be a certain amount of 20 million euros that is being put on the table. There are other possibilities. For example, you could say that you could use the transfer exclusivity model, where you use vouchers that is being used for the payment of these products, and the company can at the end use this voucher in order to generate revenues for the production of this product. The question at the end of the day is, what are we doing with all these models and how can we implement them? From theory to implementation, that is one side of the story, but can we actually receive antibiotic medication that is effective? That is the other side of the story, and that is very complicated to regulate. And this is where we could perhaps use a combination of these models together with member states.
So the way you portray this, it seems to me, and of course when we're talking about publicly available medication, we need to think about cost efficiency. How do we use the limited means as efficiently as possible? Given the scope of this problem, is it still correct to think this way? Or have we finally gotten to the point of whatever it takes? I think if you just look at the numbers, the impact of antimicrobial resistance on society, direct cost, indirect cost, then I think we've passed the whatever it takes moment a long time ago. We have gotten to a point where we need to mobilize globally. All instruments that are available should be used. This is not a surprising new approach. We have plenty of good models and good possibilities that have known great success in several parts of the world, but we just need to do it. And yes, from a political point of view, yes, we need to do things on a global point of view. The Japanese presidency for the G7 has noted that this is one of the points of their health agenda. And this can help start to get things moving on a global level. But we work with the means that are given to us. That's why it's very important to coordinate between member states so we can send them in the right direction, so that these means one day can be used to create the correct products, the products we need. Thank you very much. I can now bid my warm welcome to Dr. Liese, fresh out of the Parliament. I would like to ask you the first question. I think you are quite well versed in the subject and don't need further introduction. Do you think that this subject, the combating of these MRAs, is work for the European Union, for the pharmaceutical industry? You think we are the shimmer of hope, and you think we have different approaches and different ways to develop new active ingredients? Yes, I definitely want to say something about that. I have to apologize beforehand for not being on time. I had a very important meeting with the coordinators of a medical meeting. This was also linked to today's subject. A second quick notion before I get started. I used to work in the medical sector also, and I saw that the hospital I used to work in has given out a cry for help. I also worked a little bit in this hospital because they were just terribly short on staff and they needed everyone who could help. I've seen one child that was sick with COVID-19, but wasn't necessarily in the hospital for having COVID-19. But in the meantime, I had to give dozens of interviews with all German media. Do we need to implement stricter measures in Germany because of what is happening in China? I was asked. A very interesting point to me because the SS virus was a virus that was something that impacted 60% of the children I was helping. So we had a very intense debate about COVID-19, and I'm one of the people who always says we have to be firm. This was very much necessary in the early years, particularly in the winter of 2020 and 2021. We could have saved more lives had we done a better job, but COVID has changed. We haven't seen any dangerous mutations since November 2021, so with a relevant probability, we can think that this is something that can happen in China. The Chinese are not vaccinated and their vaccines aren't as good, so it's more of a problem for them. This is why we need to use our forces and we need to aim our guns at the problems that have not yet been solved. And for SS, we hope that we'll have a vaccine soon. And we hope that people will be willing to take the vaccine also. But the resistance of antibiotics is also a very big problem. We have tens of thousands of deaths within the European Union and many more across the world. According to me, we need at least 3 approaches to counteract this. We need to improve and limit the use of antibiotics in human medicine. Thank God we have quick tests for CRP, so we can understand if this is a bacterial illness or more a viral illness. Too many of my colleagues just use antibiotics willy-nilly. This needs to change. We also have animal medicine. If we have resistances killing people in hospitals, we also have to ask, okay, what is happening in human medicine? But this also extends to animal medicine. The most resistances are created through use for humans, through improper use of antibiotics. This is also a problem in animal husbandry. We have managed to push through legislation the last couple of years, but this doesn't go far enough, so we need to work on this further. So, getting to your question, without new antibiotics, it's not going to help. It doesn't matter how strict we are. We have the resistances now. The resistances are not going to go away even if we use antibiotics perfectly from now on. We need innovation. If we start with the question, is this an opportunity for the industry? Well, that will be very difficult in my commission. It is a necessity for my patients and for medicine. The industry can help us if the right conditions are met. That's how I would state it. This is also the role I'll be adopting for the pharmaceutical package. We need a general framework for antibiotics that are in the pipeline right now that don't go to clinical tests because it's simply too expensive and they don't know if they're ever going to get their money back. So we need a legal framework that makes possible these investments. We need to save lives. Yes, thank you very much for this clarification. I'm going to give the word back to you, Dr. Schaible. Of course, innovations and hope for new active ingredients is a way out of this problem, but it's something we have to hope for, of course. However, cutting back on the use of antibiotics is something we can do starting today. Is it possible to put the genie back into the bottle and to strongly reduce the use of antibiotics? In fact, it's possible to reduce it to the extent that the advantages the antibiotics have now can still be kept. Is it possible that the omnipresence of these active ingredients disappears and that these resistances are going to go away over time? Do we have any scientific data to back something like that up? So, in the laboratory, this can disappear once you take away the selective pressures. But there's plenty of studies that say that if we have a jump from methicillin-resistant to Staphylococcus aureus-resistant bacteria, this is a big change for these germs. The bacteria need to adapt, and they do this a lot. And when adapting to one thing, it throws out things it no longer needs. And if it no longer encounters a certain type of antibiotic, it throws it out. However, they have kept their resistances for far longer than we have thought. So the loss for their resistance was only very limited. Everything that it has to hold on to that is not practical, it wants to throw out. But still, it held on to its resistances. So yes, you can turn this back, but you need a huge reduction and a huge presence in animal medicine, in the environment. We need to cut back greatly to take away the selective pressures that exist from this. And this will have to be the case for a long time. We need to give the germs the possibility to lose this resistance. You said that even spare antibiotics are being used more and more in animal husbandry. Are there any negative examples you're thinking of in the world where countries do this particularly bad? And is this a problem that goes beyond the borders of the country? I don't think we can point fingers to one particular country. Also in Germany, we use particular antibiotics still. There are countries who have stopped using particular types of antibiotics, such as Scandinavian countries. If Sweden would add this to the presidency, this would be a very good thing. The antibiotic that was no longer being used in Scandinavian countries was colistin, by the way. But as I said, I think we really, really need to use antibiotics only on humans and only for emergencies. The problem is that the evolution is going to keep happening and we have to stop it. Germs evolve more quickly than we can find new antibiotics. Dr. Leslie, is this something that you can engage yourself for on a political level? Maybe you could show more support for Germany and other European countries not using these spare antibiotics. Yes, this is something I have done actually, but sadly there was so much resistance to this that we were not able to make any progress at all. I'm not sure if Sweden is going to be able to turn all of this around in 5 months' time. We have, however, made a decision in the European Parliament that spare antibiotics really need to be used for people only and can't be used for animal husbandry. This sadly did not get an approval from the Council. We've had further discussion about this. We've had points and mentions from organizations from the medical world, but sadly we could not find a majority for a very strict regularization on the use of antibiotics in animal medicine. They have a very well-organized lobby and they have put us under a lot of pressure. Sadly, some of us have bowed to this pressure also. When it comes to human medicine, the case is even worse because the member states say, well, medicine is our case. That's not something you have any say about, which is wrong. If you look into European treaties, we do have points we can talk about. And when we talk about animal medicine, that is not as strong as we want to do. At least there are rules for animal medicine. everywhere in Europe, if a veterinarian uses antibiotics, he needs to follow particular rules. But the regulation for veterinarians bases itself on Article 168, human health. So if I can tell something to veterinarians to support human health, I should be able to say something to normal doctors also. So this is something we need to organize on a European level. And when people die because of antibiotic-resistant germs, according to my information, 80% of these resistances are created through human medicine and 20% through animal medicine. And that is why I want to be so strict. It's very important that we don't lose track of this 80%.
Philipp, sehen Sie?
Do you see possibilities to start to launch a new initiative, a new law initiative, since you are a member of the European Commission? Are there possibilities to use this Swedish EU presidency in order to perhaps advance with regards to that? Well, the Swedish EU presidency is very active in that regard, which is a good start. With regards to legislation, I think this would be an entirely different conversation. We have already mentioned it, the pharmaceutical legislation, which is currently under discussion. I think we have possibilities there, but we have not come to a conclusion with regards to that. Also building up on the action plan in order to strengthen cooperation between member states in order to integrate, implement certain measures is perhaps another opportunity. What we do currently is to develop a new recommendation that focuses on certain areas that had already been implemented in the action plan, but that can perhaps be strengthened and be rendered more strict. This could follow the same structure, but at the end of the day, that would be an opportunity in order to increase cooperation between member states. And a third approach, second or third approach, could be what Dr. Liese has already mentioned, is to strengthen innovation. I think that is an approach that needs more discussions and needs a more targeted approach than analyzing models and analyzing what would be possible. I think this is a field where we have to advance, and I think the relevant budgets should be made available in order to advance, in order to be able to develop new antibiotics classes that can be used as spare antibiotics and as long as we really have new innovations, which usually are not being developed by large pharmaceutical enterprises, but by rather small ones. Legislation measures are obviously possible at member states level, but I think at EU level we have to strengthen member state cooperation, at least amongst those who would like to participate. Dr. Liese, we have also just talked about the fact that the whatever it takes moment has already been reached, and perhaps we are already beyond that. Do you see a possibility where we can do that in the near future due to the huge challenges the EU faces? The EU keeps promising new funding means Do you think that we can mobilize these resources? I do hope so, and I'm going to fight for it, whereby, for me, the appropriate approach would not be to use EU funds, but to develop a similar system as we use as the system that we use with regards to pediatric medication. Usually, it's not worth it for industry to actually carry out these investments, since the case numbers at the end are rather low. This is a very typical problem that the EU has to take care of, since usually it is not sufficient if an individual member state does that. I think we need incentives, and this is what they are currently thinking about at the European Commission. How can we, with an increased protection of copyright, how can we actually generate these incentives? And I was fighting for the fact to be able to do that with rare diseases and pediatric diseases, since this incentive was there. This is rather logical. Perhaps it was already being said. This new medication is not being developed, since everybody knows that if 500 million or 1 billion is being invested for an medication approval procedure, at the end of the day, they tell you that this is great, but you are only going to be able to use that medication for those who would otherwise pass away, and you're not going to be able to generate a lot of profit with this kind of medication. Therefore, for a number of years, I've been advocating for that. There's a lot of resistance, since many say that this will render medicine more expensive. And we also have the open question, do you have a better system? We've been talking about that for 10 years. Therefore, I'm no longer prepared to just accept vague statements, or at the moment, we have more than 30,000, or perhaps next year more than 50,000 people who die every year, only since we are being told that this proposal is too expensive. I think that we cannot let people die because somebody says that it is not possible to fund this solution. I'm just going to take a look towards the audience. Are there any questions from the audience? It doesn't seem to be the case. Online, I can assure you that any question you may have handed in either by the hotline or by email is going to be responded afterwards, so that nobody has to leave the event with too many open questions. I would like to thank all of the participants of this panel discussions. I have learned a lot. I hope that you here in the room and back home have learned a lot. I think this is a topic that deserves a lot of attention, and it is perhaps also an appeal towards the media to perhaps bring more attention towards that topic. This is certainly something that I am going to take back with me, since this is a very important topic. Mr. von Heusinger, you perhaps wanted to make a few closing remarks. Dear Moritz Koch, dear gentlemen here at the panel discussion, I would like to thank you all, also the Leibniz-Research Alliance, and also Professor Dr. Deitelhoff for the very good cooperation. I think it has become apparent how important this topic is, and we are also going to continue to take a close look at this topic. And I'm going to just talk about the next event, the Digital Leaders Roundtable on Wednesday. It is going to be a hybrid event so that you can follow both here in the room and also back home. Thank you very much, and a very good afternoon to you.